Hello and welcome back to my channel. If this is your first time here, I'm Nurse Alyssa, and today we're going to be discussing contact layers. So these are non-stick contact layers for wounds. But first, if you can hit that subscribe button, it would be greatly appreciated, as it truly does help my channel reach more people. So let's get started, guys. So what is a contact layer? So a contact layer are thin, non-adherent sheets that are placed over top of the wound bed to protect the tissue from direct contact with other agents that are applied to the wound, such as the cover dressing. So they conform to the shape of the wound and they're porous, allowing exudate to pass through them, allowing the exudate to be absorbed by the secondary dressing or cover dressing. They are indicated for partial or full thickness wounds, infected wounds, donor site, split thickness skin grafts, and they may also be used with topical medication. Now, some contact layers, they do come with antimicrobials already on them. So I always suggest, if you're going to use medications or ointments with these, use one that is plain, that doesn't have an antimicrobial, because we don't like to mix the two. Now, features of contact layers. So the dressing allows the exudate to be wicked away from the wound. It can be used with topical medications, like I was just saying. It protects the wound bed from trauma on dressing change when you go to remove the cover dressing. So these won't stick to the actual wound itself. So it creates a non-traumatic wound dressing. They're available in pads, sheets, and rolls. So indications for use. So we use a contact layer as a primary dressing on a partial or full thickness wound with minimal to heavy amounts of exudate. So it completely depends on the cover dressing, okay? The actual contact layer, the exudate is going to go right through, so you don't have to worry about whether or not you have too much or too little amount of exudate. But the cover dressing that you're putting over top, you need to make sure that it's an appropriate cover dressing for the amount of exudate, because it will go right through the contact layer, right up into the cover dress. Now for contraindication. So contact layers, they're not recommended for a stage 1 pressure ulcer because the skin isn't open yet. Third-degree burns, tunneling wounds, clean or debriding wounds, shallow wounds, dry wounds, wounds covered with eschar, or wounds with a viscous exudate. It does require a secondary dressing, and it doesn't actually have to be changed with every dressing change, okay? If you're changing the cover dressing every single day or twice a day, the actual contact layer, you don't have to disrupt the wound bed. You don't have to clean it. It can stay on there, and you can just change the outer layer and then go on the schedule. So normally it's about every 2 to 3 days where you would completely change everything. Now, some of the cover dressings, they are good for up to 7 days, such as Inidine, and that is a iodine-based contact layer. Now for warnings. Now, warnings really go with contraindications. So just make sure that you're always referring back to the manufacturer's information, because I'm just going over the general information that this is a contact layer. This is the general information, but each manufacturer has put out their own warnings, precautions for their specific product. Now, once again, not recommended for stage 1 pressure ulcer, third-degree burns, tunneling wounds, clean or debrided wounds, shallow wounds, dry wounds, and wounds covered with an eschar, or if they're exudating viscous material, it'll just be very hard for it to go through. But that's all I have for this video, guys. I hope you did find it helpful. I have been doing these because so many people are getting caught up on specific products, very specific products. There's a ton of contact layers out there. There's so many different brands, when in reality, they all really are the same thing, okay? Are they plain, or do they have an antimicrobial on them, okay? And then the antimicrobials, from iodine to chlorhexidine to silver. Okay, so there's a bunch of different antimicrobials that they can put on here, but when it comes down to it, if you know what a contact layer is, and then you just have to critically think, okay, Use your nerds and stonies. Do you need something with an antimicrobial effect because there's a local infection? Then use the appropriate contact layer, okay, with an antimicrobial on it. Or if there's no infection, then you don't have to use one. It can just be plain. Okay. So once again, that's all I have for this video. I hope you did find it helpful, and I hope to catch you in my next one. Bye for now.